Okay. These are the equipment that we need before performing NGT insertion. First, we should have our PPE, gloves and face mask, KY jelly, adhesive tape, stethoscope, cup of water, drainage bag, catheter tip irrigation 60 ml syringe, and of course, emesis basin, and of course, NG and OG tubes. For the procedure, first you need to check the doctor's order. And there's an order for the patient to be in an NGT feeding, and you can now proceed to the procedure. First, gather equipment, and equipment is here. The non-sterile gloves. Get my gloves. Oh man. You should wear your mask also for your protection. Your face mask. But I think I can't wear it because you cannot hear me. So, let's remove it. And then, explain the procedure to the patient and show the equipment. Good morning, ma'am. I am your nurse for today, Desiree. And we are going to do the NGT insertion. I will insert this tube in your nose to go down through your stomach for your feeding. And then, if possible, sit patient upright for optional neck stomach alignment. Yeah, you could put the patient, if conscious, patient seat para mas madali yung nose naka-align na sa neck. Ganun. Parang pa ganun na siya. And then, examine nostril for deformity or obstruction to determine best side for insertion. For examining, you cover the one, you cover the other nostril, and then the other one. Kung saan yung mas malakas lumabas ang hangin, doon ka mag-i-insert. And then next, measure tubing from ridge of the nose to earlobe to the point halfway between the end of the sternum and the navel. So this is your tube. Measure it from here to here. This is your earlobe, and from there to your halfway between the end of the sternum and the navel, or your xiphoid process. And mark measured length with a marker or note the distance. We could also put tape. It's your marker. Then, again. And then next. First, you should drape the patient and give him a cup of water with a straw. Then, you should first lubricate the tip. It should be 2 to 4 inches. The tip of again. Lubricate. 4 inches. Then notify the patient that you will, or you're ready. You're going to insert the tube. Okay. Patient A, I'm going to insert now this tube. And first, put the patient's head back and then insert until you can see that the tube goes down through the pharynx. Then it goes down like that. Turn the patient's head like this, upward. And then for easier to the tube to go down. And then just ask the patient to swallow or sip a water, and then you will push and the tube until you met the mark that you put. If resistance is met, rotate tube slowly with downward advancement towards closest ear. Do not force. And withdraw the tube immediately if there's changes in the patient respiratory system status. If there's no resistance, you can advance tube until marks is reached. And then you put a tape. And get your stethoscope. We're going to check if the tube is in the right place. After checking the placement of the tube and it's in the right place, you can permanently take the tube and get the syringe, withdraw or aspirate a sample of gastric contents. Gastric contents. Now, you're going to aspirate a sample of gastric contents then the content that you get, will pour it in the litmus paper for the checking. of the acidity of the content. So, your stomach, the content of your stomach is the pH of 3 to 4. It's very acidic. For the last step, you need to document. You should document the reason of tube insertion, type, size of tube, and the nature and amount of aspirate content, the type of suction and pressure set, if for suction setting, the nature and amount of drainage, and the effectiveness of the intervention.